So, welcome to our first guest on the Mamas Matters podcast. Well, are you really a guest? Because you'll probably hear a lot. But a guest to the viewers.
A guest to the viewers.
A guest to the viewers.
Oh my gosh.
Today we have with us Dorcas Kabahenda. Okay, so Dorcas, for those that don't know, who is Dorcas Kabahenda and what is it that you do?
I am a woman with physical disability, which I acquired at the age of 3 years due to polio paralysis. I am a mother of 2 beautiful girls. I'm proud of that.
Beautiful girls.
Yes,
Lovely girls.
I'm proud of that. I am a disability advocate. Having experience of 8 years working with organizations and NGOs on inclusivity towards employment, education, entrepreneurship, and advocating for the rights of women and girls, in particular, all persons with disabilities.
Amen. And you know what? That is so beautiful.
Yeah.
I just find it remarkable, all the things that you do. It's just honestly so inspiring.
Oh.
Every day I think about it. Like even her coming to this podcast, it was like you came and left, and the drive that you had to get here.
Oh,
you know,
yeah.
I had people cancel. I've had so much, but your dedication is unmatched.
Yeah, yeah. You know, this is because of the confidence, the determination, acceptance, and believing in myself
yourself.
as a mother. Not only as a mother, but as an advocate. You have to keep on moving,
Pushing.
pushing.
Oh, I love that. I love that.
Yeah.
And you know what? What a way to just segue into our conversation next.
Yeah.
So let's throw this out there. National Service Development funding for maternity services dropped from 95 million in 2024 to 2025 to just 2 million in cuts for funding. Urgent action is needed, reported The Sun, to fix NHS maternity services, as half of them are below the standard.
Yep.
Inspectors are warning us. Is the NHS healthcare system deteriorating? Is it breaking down? What do you think?
Yeah, according to the statistics that have been read, actually the NHS systems is deteriorating.
It is.
Looking at the recent scenarios that are taking place, like the long waiting queues, whereby you find patients are waiting for more than hours that they're supposed to wait. That breaks so many people into different situation, leading to death, leading to mortality rates of pregnant women, which is really not good.
It's not good.
And also looking at the long waiting hours for the A&E emergencies. Recently, it was 4 hours waiting. Yes, 4 hours
4
waiting
hours.
when you go for A&E emergency. But now it goes beyond 4 hours.
Beyond 4 hours.
Exactly. So you might go, for an emergency, and then you find it becomes so hard. Imagine someone is in a critical condition, but there is this procedures, like you have to wait, you have to go through different steps for you to be treated. Imagine at this particular moment.
Imagine, and you know what? Just thinking about mamas in particular that are going through like maternal, crisis, and then you need an urgent response. Sometimes if you're not a part of the system, or if there's X, Y, and Z going on, they need you to register this. They're asking about, what did you eat last week? Or they're asking all these questions, and you're just thinking, can you just help me in my situation?
Yeah.
Oh my
Actually, I would give you an example. 2 months back or 3 months back, I collapsed. I fainted, but when I fainted, I was rushed to the hospital.
Yeah.
And at that particular moment, it took more than 8 hours for me to be worked on. You know,
8 hours?
Yeah, when I reached, it was around 8 p.m. I was unconscious, but fortunately, I'm happy that I was having someone beside me. But questions after questions, like different healthy care workers coming in to ask you, you have to keep on explaining
The same
the
thing.
same thing. Someone comes to explain.
Oh my
Imagine,
God.
are you unconscious? If you have no someone besides you, it becomes very difficult to give the right information at that particular time.
And I'm guessing, obviously, this was before. So this is before the funding cuts were happening, and you having to deal with this. So imagine now what the financial burden is going to be, the strain on hospitals. They have even less funding to advocate and to facilitate people like us. And the staffing, if they're even going to have enough staffing, it's not going to look. It's not going to look good.
And also the statistic shows that substantially nearly 39,000 people are on the waiting lists for treatment, especially people with chronic conditions, whereby like you have been identified with kidney transplant, diabetes, cancer. You have to be put on that long queue. People have been waiting, and maybe they're giving you maybe for this to be to help you on this, you must wait for maybe 1 year an appointment. So that is really a very dangerous condition, especially if you are mamas, black mamas, you have a condition and you have to wait for that long period. Or you are a mama who is pregnant, but you have been identified with maybe cancer, and they have to tell you that for you to get an appointment on that situation with your cancer, you have to be postponed for.
I've heard that as well. I literally never knew this was a thing, that when you're pregnant, sometimes they can't give you medication for like terminal illnesses. Like, I never knew that because it might hurt the baby or you. Or it's ridiculous. Like, if you need help and you're in a critical condition, if I say I want this, you should be able to give it to me. No, it's my body, my choice. But they strip that away from you when you're pregnant. Like, they treat it as if, oh, you're not allowed to give a medicine. You can't do this. You can't do that. And that goes for when you're terminally ill as well. That was nice though. That was a nice conversation. But that's crazy, isn't it? That's actually so crazy. I never knew. I can't remember where it is I read it. I think I was watching something or I read a book, and it said like, oh yeah, I think it was a video. And like, you can't receive certain types of medication because you're pregnant. So they'll let you die. They'll literally let you die.
Because you can't actually, when you're being diagnosed with these certain chronic conditions, and at that particular moment you're pregnant, it becomes more challenging for you. And it's very hard. It's very hard to handle true conditions at a go.
And you know what? Pregnancy itself, all the mamas know this, it's no joke. If you've conceived, even the symptoms emotionally, mentally, physically that you feel, they're already so demanding. So to top that off with another terminal illness or something that's, you know, aggressively attacking your body, where you're not feeling strong or you're not feeling capable, I can only imagine the cry for help moms are probably experiencing. I've never experienced it myself, thank God, but you know. Okay. And just to tap into that the Sun report as well. Inspectors, so you know how you have schools and like Ofsted will come in to grade schools. So if it requires improvement or if it's like satisfactory, it's not very that good, like, let's be honest. Basically, hospitals have inspectors as well. The report is urgent action. It's not like it needs urgent action is needed for NHS Maternity Services to be of a good standard, because they're below the standard, and I'll put something on the screen to show that as well. So the service is already not good, and then the lack of funding is going to make it even worse for the people that are already experiencing.
Also, on that, shortage of healthcare workers in the health sectors. You might find that there is high demand of services in comparison to the supply. The fact is that there's so many things to, like, there's so many services that are needed to be given, but there are very few health workers to take in for that. You realize
That's why they've always got students.
Yeah, students. Actually, you might find that in the when you go for the healthy services, you might find it is the students who are working on the patients.
That happened to me.
You get working the patients.
That's what happened to me.
And I think, I don't know what you think, is it because that there are few people who are going on for healthy courses compared to any other courses that is leading to the shortage of having few healthy workers?
I think maybe just because I had some insight in a student working in the field and I had an opportunity to do some research. When I was doing research, it actually said that a lot of students will train up, and because of the stress or the dynamics of like the hierarchical aspects working within a hospital and having doctors above you and all those types of things, people are coming off the course or leaving the course, not really liking the field. People probably in the field, obviously look at the demands. Their working hours are probably toxic for anybody. They're probably developing chronic depression and all sorts. So I think it's literally because people aren't going into that field, and when they try to, they're not having a good experience, so they're leaving.
Yeah, because actually, when there is shortage of healthcare workers, this brings lots of like those who are already working. They work with an attitude, anger. Already, they have a burnout. They are really tired.
They're taking it out on you, the patient, who they're supposed to be caring for.
Exactly.
Especially mamas that are already in such a vulnerable position.
With such information that we've really shared, I think there is a very need urgency to find to address this solution to make sure that issues that making the system deteriorating should urgently be looked at and find ways on how things can work better. Yeah,
definitely. I think that's a nice segue into the next one.
Yeah.
So that's just to put into context the small population of the BAME community.
Black women are still 4 times more likely than white women to die in pregnancy or childbirth. Yes, childbirth in the UK, and women from Asian ethnic backgrounds face twice the risk.
Wow.
You get?
Out of that, 82% are white, and then, 20-something percent BAME, making up BAME ethnic groups. So that's Black, Asian, all those groups. And then out of that small pool of the population that are Black, why is it they're 4 times more likely to die? It's just... seems intentional.
Yeah, for sure. On this case, when we look at the disparities into this, Black women have got a certain factors, so many factors that might lead to that. These factors might be the socio-economic factors. And the socio-economic factors, here we are looking at education, we are looking at employment, we are looking at the housing system, and also looking at maybe the cultural factors. Why do we say employment? A Black mama who is already vulnerable in terms of employment, you're not working. We're also looking maybe being a migrant, actually. All these factors might contribute to having a bad healthy care. You understand, or experience the worst condition. First of all, might be your education background. Some people,
you're not educated.
You're not educated. Take a look at the Black mamas who have migrated. You've come from maybe Congo. The only language you know is your mother language. You get, and you can't express yourself. And you're pregnant. You've gone for maternal health service, but you can't even express yourself. And because of now the issues of the racism and that bias, then you might not get the services that you need. The housing, it's hard because when you come or you're in the UK as a Black mama, because you are not entitled to the benefits, you are not entitled maybe to a very good health housing.
No recourse to public funds.
Public funds,
can't use NHS.
And NHS, it becomes really hard for Black mamas. These disparities might lead them to experience to these healthy care outcomes experiences that they go through. But also we can look at the pre-existing healthy conditions that Black mamas not only might be having being pregnant, but some of them might be having already other conditions, diabetics.
That's true.
Hypertension.
And what effect does that have on pregnancy as
And
well?
then what does it have on pregnancy? Because as a pregnant woman, having diabetes is very, very complicated issue on you. Having hypertension is a very complicated that might lead to the loss of your baby or maybe the loss of your own life. So imagine you're in such a condition, it becomes more worse to a Black mama compared to a white mama.
Yeah.
You understand? Racism and the bias.
I think, you know what, if I'm being honest, I think that's what it is. Because there's nothing else that can point to why there's such a big disparity.
Yes.
Let's be honest. So is it because I'm a Black woman and you're a white nurse caring for me? They're very vulnerable. We're our most vulnerable, I think, when we're pregnant, when we're giving birth.
Yep.
Is it because I'm Black that you're not giving me a certain level of treatment?
Yeah.
Is that what it
is?
is?
It because I'm Black, or might be bias? It might be even not being Black, but bias. You are Black and you are a woman with disability.
Oh my God,
It's
multi-layers.
Yeah, it's multi-layers. You're a woman with disability, and most cases you'll find that as maybe women with disabilities, besides other Black women, it can be like they always might be prone to other conditions on them, and as such it becomes a challenge when you are going for antenatal health services. You experience these issues.
Can you tell me about an experience maybe that you've heard supporting a mom that was pregnant but she already was disabled, or an experience that most of viewers probably haven't heard of?
It might not be like experienced here in the UK, but
that's good.
Yeah, here in the UK, but in my field of work, I remember there was this lady who went to the hospital because why am I say I'm bringing this scenario? Our experiences are always the same, whether here in the UK, whether outside in the UK,
and everywhere it matters,
and everywhere in the world, in the healthy care services, almost we face the same challenges.
Yeah.
So this lady, she went to the healthy care center for accessing a service as a woman with disability and to be attended for an antenatal service. But at reaching to the hospital, she was crawling down actually. So when she was crawling down, when she reached to the hospital, the midwife told her, the way how you got that pregnancy, can you be able to use the same way to climb maternal bed for treatment? But imagine this lady, the bed is raised, she can't lift herself, and already the midwife is biased. I think she doesn't want to touch and all that.
It's quite degrading actually.
Dehumanizing. Exactly, dehumanizing.
Yeah.
So what I have to do is to come in as an advocate and speak on their behalf to the nurses after hearing that, and to show them that it's not about the condition of the person, not the disability, because this person has the right, like any other person, to access medication, to have the right to give birth like any other person.
And the right care and support. Because as I can see, she seems a bit passive aggressive. She seems just a bit standoffish. Yeah. And you're supposed to be trusted in this person's hands to care for you. Yeah. They're treating you this way.
So it's really important that it gave me more knowledge to know that there is a lot more thinking, that there is a lot that needs to be done at the health sectors to ensure that not only in being inclusive, putting a ramp and you can be able to enter in, but also the biased mind that are within the health workers need to really be changed, because this mother here, has come to get a service, but has gone back not only having a service, but already mentally disturbed.
Mentally.
You
And
get-
I think I've always thought it's worse to experience things that play with your psychological
Exactly.
or your mental, because it's like you can't switch it off once you've left that situation.
Yeah,
Physical, if someone hits you,
yeah,
they can't hit you again if you're out of their presence.
Yeah.
But if someone says something, like when you're a child and it hurt you, you can think back to that moment and remember it. Or you still might have those impacts on your confidence, or, so it's even more paramount that doctors that are caring for us use kind words that are nurturing, that give you the feeling of support and care.
Black women are 6 times more likely to have
Preeclampsia.
Yeah.
I think that's how you pronounce it.
Yeah, something else.
Preeclampsia. I had preeclampsia.
Yeah, can you explain more about that?
Well,
What does
I
it mean?
actually didn't know much about it until I was diagnosed. But when I went to the hospital, I know that they said I had to wee in a cup. So I had to wee in a cup, and then in my urine they tested if I had protein. So I think that's one sign or symptom that you might have preeclampsia. I had swelling of my feet and my hands, which is common in pregnancy anyway.
Yeah, of course.
Especially third trimester.
Yeah.
So I had that, and I think there was one more thing. Oh, my blood pressure. My blood pressure was high. So I think that's a few symptoms. And apparently black people are 6 times more likely to have preeclampsia.
Yeah.
We need to talk about that more, because I've never heard of it ever.
Yeah, and I think sometimes this happens not before pregnancy, but some condition comes during pregnancy.
Yes, that's it. And I think that's mainly a condition that happens
It
during
comes
pregnancy.
during pregnancy. I might take an example. Like personally, I had never experienced the hypertension.
What is hypertension, for the viewers that don't know what that is?
Okay, the hypertension. This is the high blood pressure that always arises in women, or even any other person, that either might lead to a very dangerous or critical condition. So it's really, really complicated. And when it comes to pregnant women, this is a very, very, very important condition that the health care workers need to pay attention on, because it might lead
to something else.
It might lead to death, actually. You as a mother, it might lead to miscarriages.
As the statistics say,
Rate is
higher
60% higher.
In black women.
Yeah, in black women.
I just think, why is that though? Is it because maybe they're not taking the readings of like the white people as much, or what is it? Because is it something biological, like genetics, that us black people might have? That's why we're more prone to preeclampsia. Like, do you know what I mean?
Yeah.
Like, what is the reason?
No, I think one of the reasons is many black women, they go through so many issues like depression, anxiety. You get depression, anxiety, and of course, imagine as a mother, a black mother, or as any other woman, when you're pregnant, one thing they will tell you: don't stress.
And I was just thinking that. I was thinking, you're right, because I worked up until I gave birth, 2 days before I gave birth.
Yeah, don't stress.
I was stressed.
As soon as you stress, your
Everything
blood
goes
pressure,
up,
everything
blood pressure
goes high. Your
But you know
blood
what?
pressure will go high.
That has got me thinking. That's why I don't really like the NHS healthcare system, because as you can see, there's a strain, like we talked about earlier, on the funding, the strain of, there's not enough staff. So they're putting their frustration, their stress on the pregnant mama. So if you're dealing with feeling like you're not being cared for in the right way, you're not being listened to, majority of women say they feel like they're not being heard. 84% of women, that's a lot of women, saying they don't feel like their healthcare visitors are. So if you're in that situation and you're pregnant, of course you're going to be stressed out and your blood pressure is going to go up.
Yeah.
And if they're not caring for us just because we're black in a certain way, no wonder why our rates are higher in certain things, because we're stressed out.
Also, another cause might be lack of enough research and education among black mamas.
Yeah.
The information, like you might really not know what happens, how does it operate as when these conditions come, what do you need to do, what causes them. And
so maybe that's a question for the viewers. Do you think we need more, education when it comes to healthcare and maternal care in the black community? I think so.
Yeah, I think so. Of course, we need them. First of all, we need it because we need to be informed of which services we need to
and
access.
of our rights.
And besides, after getting to know which services we need, then we also have to know our rights on which services are we entitled to, and we have to climb for them because it's our rights to say, this is what I want.
And I think it's also important talking about like what we're entitled to, also what we're entitled to say no to.
Yeah, to say no to.
A lot of the healthcare, they like to push the narrative and push whatever they want to come, the outcome they want. But I think it's important for us to know what we can say no to, so then we know that it's harassment if they keep on pressuring you into a certain thing, or do you know what I mean?
Yeah.
Because a lot of people, because they don't know, as a right to being a mum or dad of the baby or over my own choices, I can say no to that. Because they don't know, they just go with whatever the doctor says. And that's also risky.
Yeah, actually, when we look at information, I didn't know, I've just come to know a lot since I joined Mama Matters.
Yeah.
Even things that I never knew for the past 2 years that I've been in the UK. First of all, if I didn't know, then what about the mothers who are here and they don't know? For example, I didn't know that there are the statistics shows that mamas who are giving birth for the very first time, they are being given up to 10 appointments in the hospital. Then for mothers who have ever given birth, you are entitled to have up to 7 appointments.
I never knew that. I never knew that.
Yes, up to 7 appointments.
But really, it should be a blanket for each pregnancy, right? It should just be, you should have as many as you need.
Yeah, as many as you need. Yeah. But that's actually how it is being shown.
Okay.
But when you look at how those appointments are distributed, it depends on the needs of mamas at that particular moment.
Yeah, that makes sense.
I might be, besides being pregnant, but I have other pre-existing conditions that might not need me to wait for those interval of the appointments have been scheduled for me, but it must be more than that.
Yeah,
you
it's
get
true, more than
it
you
must
can't be
be more
capped
than
at
that.
10 if your risks are saying you need more than that.
Yes. So why I brought in this information is some mamas doesn't know.
That's true.
They don't know that, I'm entitled to this and it's my right if I'm giving birth for the first time. And I go to the hospital and they're telling me, oh no, you can't come into the hospital.
Or we don't have enough
space for you. Maybe can you wait for the appointment?
Or you have to get there and wait hours.
And waiting hours. You have a right to speak up.
Amen.
To build the capacity and the confidence of mamas.
I think so.
You get? You're building their capacity and confidence so that they can be able to stand on their own, like you said before, to say no to certain things and to say yes to certain things.
And just know also if what their carers are doing is right or wrong. Because how are you supposed to know? You're just going to have to accept if you don't know what the right thing is. That
If you don't know the right thing,
you're just going to accept whatever it is they're doing.
Exactly.
Yeah.
If you're going to the hospital, for example, I can give you an example, and you've gone to the hospital and they're telling you like, oh yeah, the child you're carrying might have or have already, might be a complication or a disability, so might be that kind of stuff, so might even die. Dear. Would you like to abort this baby or to take out the pregnancy? So if you cannot stand on your own as a confident, as someone who are already capacity have been built with strong esteem, you have to make an informed decision.
Yeah, don't just go off what they're
Don't just
saying.
go say, oh yeah, I think if it's like this,
If the doctor
I think
says
if
it,
the
then it
doctor
must be
says,
right.
then it must be right.
That's
I
not
think
true.
I should go for this.
It's true.
So what
It's
you have to do
true.
is take informed decision and go back to your room and
Go
think
back
like,
to
is
educate.
this right?
That's right.
Should I do it? So whatever you're going to say, you own your own decision.
That's true. Because it is your decision, your journey, your choice.
Exactly.
They should be there to support you.
Like
Period.
also shows your journey, your choice.
Okay, let's have a look more into that intersectionality then, because we've spoken about the disparities of black women. We've spoken, touch base on like having a disability.
Yep.
Now, what would that look like if we're faced with all these different things all at once? So let's create an image. It says here, disabled women in the UK who make up to 20% of reproductive age. That's when we looked at that report, that shocked me, because I didn't even realize or fathom that. Wow, that's actually 1/5 of our population of reproductive. And you wouldn't think that is that common, because I don't see it often in healthcare, or I don't see the healthcare shifting it so that this part of our society is, looked after in an appropriate way.
Yeah.
So that shocked me. So that might shock some of the viewers. It says disabled women in the UK are 44% higher odds of stillbirth or neonatal mortality for infants born to disabled mothers. 44%.
Wow.
It says here also they're 30 to 69% more likely to have a cesarean birth. For a mother that might come here and then they're not speaking English and then they fall pregnant, what does navigating the NHS healthcare system and they're black look like for them? That sounds scary to me.
Yeah,
if I'm being so honest with you.
so much. It's scary. When we look at the role of intersectionality, is what we're looking at, right? Yes, the role of intersectionality. First of all, it helps the NHS.
Does it?
Yeah, the role of intersection, it helps the NHS understanding the complex conditions. You understand?
The layers.
Health inequalities.
Yeah,
to understand those health inequalities and know, okay, how is this going to help us? Actually, it helps to tailor maternal health services according to individual
It's
needs.
true, but that's only if the health services are conscious about being person-centered. So someone that, based on the statistics, it's already looking like you're black in this country.
the black. Yeah, because now in this condition, first of all, looking at the intersectionality, you are a black woman. You
That's
get
one layer.
One layer. And being a black woman, you are
Already at disadvantage.
You're already a disadvantage. You're a woman with disability.
That's another layer.
But also your education levels
That's true.
also makes you vulnerable. You understand?
Whether you're
And also the race, the gender. You're a woman, of course, like we said. So when you combine all
these
these
layers.
together, all these layers, maybe you're an immigrant who has not yet even gotten any status in the UK. You're still under the asylum level. You are not entitled to any service.
Yes.
So all these things.
And just to start to go into there, it says being a refugee or migrant can be considered a risk factor in itself, like you just said, such as lower socio-economical status, higher burden of disease in the country of origin, language difficulties, or low health literacy. So you don't know how this healthcare system works. So imagine a mom being pregnant and using this system and being black and of color
and being black and all those layers. So and also besides having all that, but then having also some condition on you, so it becomes too much.
It becomes too much. It becomes to a point where it's like, right now, as the NHS system, not saying like our healthcare system compared to some other countries, it's still good, it's advanced in comparison. But looking at a woman like that or someone going through the system like that, will they really get the care that they are entitled to? No, I don't think so. Especially with these cuts and with the services that people that don't have these multiple layers of intersectionality, on them. They're not going to get cared for in the right way.
They can't. So I think it's very important that this role, it will make the NHS to realize it's like
Where their areas
where
are,
the areas
they need to
are, that
improve.
despite of like people's women gender, race, and then disability, and
All those
then
layers.
conditions of those layers.
Dear.
Sometimes I close my eyes and say, all these conditioned on one person. You guys, on one person, it becomes a very big challenge.
It is a challenge because when you take them as isolated instances, they already are a big challenge. So an individual having all of those compounding for them and their experience, it's quite,
but I think also another thing, it can also help like complex identities, and this can create a more inclusive and equitable environment.
It's so true.
Sorry?
That's true.
Yeah, by a female woman. So it is the role of the NHS to understand these cultures and know that if this person comes in, they have a right. We have to. This is what they believe in.
Yeah.
This
We need
is
to
their
fit
culture.
their
We need
customers, their service.
exactly to customize their service,
Adapting the care for the individual.
Exactly
And I feel
for
like
an
the
individual.
NHS is not good at that at the minute, are they?
Yeah.
Clearly.
So this is why we are looking at that they should be inclusive. They shouldn't only be static on, because this is what we have
This
to
is
do.
what we do. This is our system.
That is our system.
No.
But they should be they should be equitable and inclusive in all areas.
In all areas. Speaking on that, let's move on to what do you think our viewers can start doing to make a difference and to make action? That could be, the NHS could be watching. That could be an individual at home on a couch. What is something that they can do to make a difference and to start to take action on everything we've discussed today?
One thing I would recommend, or I would urge you, the viewers or the NHS do, is they should review their policies.
Okay, speak more on that.
You review their policies, because when we look at what we have talked about, it doesn't mean that the NHS or they don't have policies driving all these things
stuff.
for these.
That's true.
For all these what we're talking about.
That's true.
If it is right, there is human rights. There is a right to access to inclusive and equitable healthy care services for all people, despite of who you are, despite of your color or maybe your gender and all. So they should always go and review, update, and then change where things are not working well, so that they tailor very well their services with the needs of
The individuals that come in.
that are coming in.
That's amazing.
To
Thank you.
their services.
Okay, and one thing you want the viewer to take from this episode?
One thing I would want the viewers to take of this episode is this program is here for all mamas.
Amen. That's true.
And also what I would encourage, that despite of who you are, of who people are, despite of people with disabilities, let our communities encourage each other. Let the healthy care service, the healthy centers, the NHS services be inclusive and encourage everyone to make sure that they participate. They participate into making sure that all our services in the community, in the health services are very welcoming. Mama Matters is here to support each and everyone. We are here to support everyone. Get more information, more knowledge, more skills. Get to know more about their healthy, about more of their pregnancies, and then they can stand on their own to live a better life and enjoy their motherhood enjoy their
peace.
parenting, enjoy their services. They don't feel like that is not meant for me, but it is for all of them. That's why we are here to tell them that they shouldn't fear. There is nothing hard. Everything is possible as long as that you believing in ourselves. Everything is possible if we are working hand in hand, both the community, Mama Matters, the NHS. We can really make a great or a tremendous work that can change our health sectors, experiences, generation, and let Mama come out, speak out their experiences.
Speak up for yourself and stand up for
Yeah,
yourself.
speak up the experiences.
Share your experiences.
Share your experiences. It is this experience that will help other mamas to feel like, oh, I've never known about this. Like I didn't know about the
statistics that we share.
Exactly, the statistics that we share.
And that's a good point, because I think sometimes as well in the Black community, another reason which is within our control why we might be experiencing more of these things is because we're not having these conversations. So speaking to people, speaking like me and you are having this podcast today, speaking to your friends, speaking to your mom, speaking to your grandma, speaking to Black moms that you see in the community, sharing knowledge and insight so you're feeling more informed.
Yeah, and like you said, that we are not afraid to speak about the issues that are pressing us. You get it? We are not afraid. So I call upon also mamas to stand on their own and be confident.
Exactly. What's the worst that can happen? When you speak up for yourself.
But all in all, what we are aiming at is to ensure that the Black mamas really live an inclusive life, happy life, and feel at peace feel at peace in everything they are doing
throughout your pregnancy.
Throughout your pregnancy, birth, and beyond that, and
Thank you, Dorcas. All right, thank you for watching this episode. We really hope you enjoyed it. Join us again for another episode where we'll be talking about Black baby loss awareness. Thanks, Dorcas.